Section 1. Let's talk honestly about getting older as a man. Gentlemen, I want to start this conversation the way I talk to my patients in the exam room. Calm, straightforward, respectful. My name is Dr. Thomas Carter. I've spent about 30 years working with men over 50, helping them protect their energy, their blood flow, and their sense of confidence as they age. And there's one topic that comes up more than almost anything else. Not cholesterol, not blood pressure. It's performance. Potency. That quiet internal feeling of, if the moment comes, my body will show up for me. You might have noticed that things don't quite snap to attention the way they used to. What once felt automatic now feels slower, less reliable, or just a little bit distant. Maybe the firmness isn't what it used to be. Maybe you're dealing with a weaker stream when you use the bathroom, more frequent trips at night, or that stubborn ache in your lower back and hips. Most men I meet think this is just the bill that comes due after 50. Doc, I guess this is just getting old, right? I don't buy that. Yes, age plays a role. Hormones change, blood vessels age, life stresses pile up. But what I've seen over and over again is that what we call getting old is often a slow mechanical problem that has been building for decades in one very specific area of the body. Think of it less as your body giving up and more as your body getting jammed. And here's the big idea we're going to walk through together in this video. There is a small but powerful spot in your body that acts like a command center for blood flow, nerve signaling, and tension in your pelvic region. When you learn how to gently massage this area for just about a minute a day, you can encourage healthier blood flow where it matters, release deep muscular tension you didn't know you were holding, take pressure off sensitive nerves that control sensation and response. This is not magic. It's not a cure-all. It's simply smart, targeted maintenance for an area that modern life has been abusing for years. Before we go any further, a quick reminder. I'm a doctor, but I'm not your personal doctor. This video is for education, not diagnosis. If you have pain, a history of pelvic or prostate cancer, recent surgery, or worrying symptoms, please talk with your own physician before trying anything new. Now, with that said, let's look under the hood and talk about what's really happening down there. Section 2. The hidden traffic jam in your pelvis. When a man tells me, "Doc, I just don't feel like myself anymore," I start with 3 simple questions. How's your blood flow? How tight are your muscles? And how well are your nerves actually carrying the signal? You don't have to be a scientist to understand this. Let's break it down in plain language. First, blood flow. An erection is mostly a blood flow event. The tissue has to fill quickly, like a dry sponge soaked under a running faucet. The arteries that carry blood into the pelvic region have to expand, respond, and deliver. Now think about modern life for a man in his 50s, 60s, or 70s. Decades of sitting at desks, in cars, on couches. A diet that may not always be ideal. Stress. Sleep that comes in pieces instead of long, deep stretches. Over time, the inner lining of those blood vessels stiffens. They don't open up as easily. On top of that, when you sit for long periods, you're literally putting pressure on some of the key blood vessels running under your pelvis. Less flow in, less pressure when you need it, less spontaneity. Second, muscles. There's a group of muscles called the pelvic floor. You can think of them as a hammock of muscle running from the front of your pelvis to the back. These muscles help control your bladder, your bowels, and your sexual function. Most men have never even heard of them, but they spend years clenching them. Stress, poor posture, sitting with your hips bent all day. All of that leads to a strange combination: muscles that are tight and tired at the same time. They're like a rubber band that's been stretched and held for too long, taut but with no snap left. When those muscles are always clenched, they can squeeze the very blood vessels and nerves that need room to work. It's like trying to drive through a tunnel that's slowly collapsing in on itself. Third, nerves. The nerves that carry sensation from the pelvis and send the go signal for erections travel through this same tight, crowded neighborhood. When the muscles are tight and the tissues are congested, the nerves can get irritated or slightly compressed. What does that feel like? Duller sensation, slower response, feeling a little disconnected from your own body. Emotionally, this is where many men start to feel that quiet, heavy doubt. Maybe I'm just done. Maybe this is it. I want you to hear this clearly. In many men, the problem is not that the system is dead. It's that the system is jammed. The good news? There is a way to gently open up that traffic jam at the exact intersection where blood vessels, muscles, and nerves all pass through. That spot is what we're going to focus on next.
Section 3. Finding the command center spot safely. The area we're talking about is called the perineum. Some traditional systems of medicine describe it as a central energy point for the body. In modern anatomical terms, it's simply a very important crossroads. Let's locate it in simple, practical terms. If you're sitting on a firm chair right now, shift your weight forward a little. The perineum is the area of soft tissue between your scrotum and your anus. Not up in the testicles, not inside the rectum, right in the middle on the outside. For many men, if you gently explore that area with a finger when you're relaxed and in private, you'll find a spot that feels a bit more tender or different than the surrounding tissue. Not sharp pain, but a kind of, oh, that spot is tight feeling. Under that soft tissue is where several important structures meet: muscles that help with erection quality and ejaculation, blood vessels that carry blood into the spongy tissue of the penis, nerve branches that carry sensation and control. Now, before I teach you the massage routine, I need to give you some safety guardrails, the same ones I give my own patients. If any of the following apply to you, you should talk to your healthcare provider before trying this. You've had recent surgery in the pelvic or rectal area. You have active infection, significant pain, or visible swelling in that region. You have a history of prostate or rectal cancer and are under current treatment. You have unexplained bleeding or severe pain in the area. Also, this should never hurt. Mild tenderness is okay. Sharp pain, burning, or numbness that lingers is not okay. Pain is your body's way of saying, back off. Think of this as a gentle maintenance routine, not a deep tissue assault. In a moment, I'll walk you through a simple 60-second sequence you can do once a day in the privacy of your bedroom or bathroom. It's discreet. You don't need any special tools, just your hands, a bit of appropriate oil, and 1 quiet minute. Before I teach you the routine, I'm going to ask you a favor. If you appreciate conversations like this, the ones most people are too embarrassed to start, but every man needs to hear, tap the like button right now and subscribe to Healthhub. It helps this kind of information rise above the noise, and it tells me that men like you want more honest, practical guidance without judgment. Now let's talk about exactly how to do this the right way. Section 4. The 60-second gentle massage routine. All right, let's build the routine step by step, just like I would in the office with a patient. First, your position. The easiest way for most men is to lie on your back on a bed or firm couch with your knees bent and your feet flat. This relaxes your hips and takes some of the tension out of your lower back and pelvic floor. Another option is to sit on the very edge of a sturdy chair with your feet flat and your knees slightly apart. The key is this: you should feel stable, not twisted, and you should be able to reach the area without straining your wrist, shoulder, or neck. Second, your hands and oil. You don't have to use anything exotic. A simple skin-friendly oil like fractionated coconut oil, sweet almond oil, or a high-quality castor oil is often enough. Avoid heavy petroleum products or anything heavily perfumed in this sensitive area. Put a small amount, about a teaspoon, on clean fingers and let the oil warm up in your hand for a few seconds. Now we move into the 60-second gentle sequence. You can think of it in 5 short phases. Apply and settle, about 5 seconds. Apply the oil to the area between the scrotum and the anus. No need to rush. This first touch is just to let the tissue relax and get used to the contact. Find the tender but tolerable spot, about 5 seconds. Use 1 or 2 fingertips to explore the center of that area with light to moderate pressure. When you press straight up toward the ceiling, you may feel a spot that's a little tighter, a little denser, or slightly more sensitive than the rest. That's often your main target. Small, gentle circles, about 30 seconds. With that same moderate pressure, think firm enough to slightly indent a ripe tomato, but not enough to break it. Begin making slow, small circles over that spot. Go in one direction for about 15 seconds, then switch directions for about 15 seconds. Your breathing should stay slow and easy. If you notice yourself clenching your stomach, jaw, or buttocks, you're pressing too hard. While you do this, picture fresh, warm blood moving into the area and tension slowly uncoiling out of those deep muscles. Press and release, about 20 seconds. Now switch from circles to a steady, gentle press straight up. Hold that pressure for a count of about 5, then let your fingers relax and release fully for a count of 5. Repeat this 2 or 3 times. Many men describe this stage as the point where they suddenly notice a melting sensation, a sense of the tissue letting go a little, or a wave of relaxation in the pelvis. Finish with a deep breath, about 5 seconds. At the end, remove your hand, rest it on your abdomen or to the side, and take one slow breath in through your nose, let your belly rise, then exhale fully through your mouth, letting your shoulders drop. That's it. You're done. No forcing, no grinding, no pushing through pain. What should you expect? In the first week or 2, many men notice a sense of warmth or heaviness in the pelvis after the massage, a bit more relaxation in the lower back or hips, a slightly stronger, clearer sensation during arousal. Over several weeks, if you stay consistent, some men report better reliability and firmness, fewer nighttime bathroom trips, and less of that constant tight, clenched feeling in the hips and tailbone area. Again, this is not a guaranteed cure. It's one tool, but it's a powerful way to tell your body, I'm going to start taking care of this area, not just ignoring it. To supercharge the benefits, you can pair this with a few simple lifestyle adjustments.
Section 5. Small daily habits that multiply the benefits. I like to tell my patients, the massage is the spark, but your habits are the fuel. Here are a few specific changes that make this 1-minute routine even more effective. First, hydration. Better blood flow requires good fluid balance. If your blood is thick and you're chronically dehydrated, it's like trying to push muddy water through a narrow pipe. A simple guideline many of my patients use is aiming for roughly half their body weight in ounces of water per day, unless their doctor has given them different instructions for heart or kidney conditions. For example, a 180-pound man often does well at around 80 to 90 ounces spread across the day. Second, sitting less and moving more. Every hour you spend hunched over a laptop or slouched in a recliner is another hour of pressure on those vessels and nerves. You don't have to live in the gym, but set a quiet goal. Every 45 to 60 minutes, stand up, walk around the room, roll your hips a little, or stretch your thighs. Those tiny breaks are like opening up lanes in that traffic jam we talked about earlier. Third, basic stretching for the hips. You don't need to be a yoga expert. Even simple moves like lying on your back and gently pulling one knee toward your chest, or sitting on the edge of the bed and leaning forward over your thighs can help loosen the muscles that tug on your pelvic floor. Do a couple of stretches after your massage. Think of it as sealing in the work you just did. Fourth, sleep and stress. Sexual function is not separate from the rest of your life. When you're exhausted, over-caffeinated, and constantly worried, your body spends more time in fight or flight mode. In that state, your nervous system deliberately sends blood away from your pelvis and toward your big muscles and heart. That's great if you're running from a bear. Not so great if you're trying to feel connected and present with your partner. Even 10 to 15 minutes of quiet time in the evening, reading, breathing slowly, stepping away from screens, can shift your body into a calmer gear. Combining that with your 1-minute massage before bed can be a powerful routine. Now, I want to pause and say this clearly. If you're already on medication for erections, if you have diabetes, heart disease, or other medical conditions, this massage is not a replacement for proper medical care. It's a complement, a way to support the mechanical side while you and your doctor work on the metabolic and hormonal side. But it's also a way to reclaim some control. You're not just waiting to see whether a pill will work tonight. You're actively improving the base that everything else depends on. And if this kind of practical, male-focused health guidance is helpful to you, let me invite you again. Subscribe to Healthhub. Share this video with a friend you trust, and leave a comment about where you're watching from. You'd be surprised how many men around the world are quietly working through the same concerns. Section 6. Your confidence is worth 1 minute a day. I've had men sit in my office in their 50s, 60s, even their 70s with the same look in their eyes. They're not just worried about sex. They're worried about what the changes mean. Am I less of a man? Is this the beginning of the end? Is my body just done responding? I want you to hear this from someone who's seen thousands of cases across 3 decades. Your worth as a man is not measured by one body part, one moment, or one night. But I also know how deeply physical confidence is tied to emotional confidence. When you feel strong, responsive, and in control of your body, you carry yourself differently. You show up differently in your relationships, at work, with your family, with your grandkids. That's why I care so much about simple, practical tools like this. A 1-minute daily massage of this command center spot is not about chasing perfection. It's about reclaiming comfort, reclaiming ease, reclaiming the sense that your body is still willing to partner with you, not fight against you. When you reduce tension in the pelvic floor, improve blood flow into the pelvis, and give those nerves a bit more breathing room, the benefits often spread wider than you expect. Better control and fewer leaks when you use the bathroom. Less nagging lower back and hip discomfort. More natural, less pressured intimacy with your partner. A quieter mind. Less fear of what if it doesn't work this time. Will every man respond the same way? No. But in my experience, many men are shocked by how much can change when they start actively maintaining this part of their body instead of just hoping it holds together. So here's my challenge to you. Pick a time of day, morning after your shower, or evening before bed. Set your phone reminder if you need to. For 30 days, give yourself that one quiet minute. Approach it as an act of self-respect, not desperation. Stay gentle, stay consistent. Notice the small changes in your sleep, your comfort, your mood, your response. And please keep your doctor in the loop. If something feels off, if you have pain, or if you have a medical condition, your healthcare provider needs to be part of the conversation. Teamwork always beats guesswork. If this video has given you a bit of hope, a bit of clarity, or even just a sense that you're not alone, let me know. Hit the like button to say, I'm taking my health seriously. Subscribe to Healthhub for more straight talk guidance for men over 50. And in the comments, tell me, what's one small habit you're willing to start this week to support your vitality? You deserve a body that doesn't hold you back from the moments that matter. 1 minute a day is a small price to pay for that kind of freedom.